everyone, my name is Mackenzie. I am a registered massage therapist, and today we're going to be going over some tips and tricks on how to massage your partner at home. This video is intended for those who have attended a couples massage workshop that I've held here at Nest Integrative Wellness in Edmonton, but it can be used as a standalone. You can use it to get some tips and tricks on how to massage your partner at home. Before we get started, I do like to put a little disclaimer. If your partner has any ailments, injuries, diseases, or is on any medication, it's important to know the risks associated with those. So be sure you either do research, ask a doctor, ask a registered massage therapist, in order to know that you're not going to be causing them any harm. The first technique we're going to go over today is always our opening technique. It is called effleurage. It is a French word. It means to skim. I like to think of it as a long, fluid technique from the farthest part from the torso to the closest. So if you're working the legs, you're going from ankle to knee to hip. If you're going on the arms, you're going from wrist to elbow to shoulder here. If we're working the back, you can technically do it either way. You can either go from shoulders down towards the hips, or you can go from hips up towards the shoulders. Does not matter. It's all up to personal preference. I prefer to go from hips all the way up to shoulders, and I like to give the shoulders a nice grab while I'm up there. So our main use of effleurage is to really just spread the oil. So we put the oil on our hands, we warm it up because nobody likes to get massaged with the cold hands, and we put it on the part of the body that we're starting with. So I'm going to show you a video. We're going to start with the low back. You can see that my hands remain in contact with the back. I fluidly and slowly stroke from the hips all the way up to the shoulders. The pressure is coming in from my palm here, not in my fingertips, although my fingertips are staying in contact with the person I'm massaging the entire time. I like to do all of these techniques at the very least 3 times each. So effleurage 3 times, hips to shoulders 3 times, nice, slow, controlled, and we're not doing it like we're spreading sunscreen. That is my biggest ick. I hate watching people spread the oil like that. We are going very slow, very controlled, and I know I'm going to say that so many times because it is the biggest issue I see most people have when massaging their partner is they are going fast and they're going furious. After effleurage, we can go into a variety of techniques. I like to start out with a very similar one to effleurage, just a deeper version. So you can either go in with your knuckles, using the flat part of your knuckles there. You can go in with your palms, just putting more pressure through the palms. I find the palms are a good one if they don't like a lot of pressure because it can be a bit tricky to get a deep amount of pressure through this broad area. And then if they like the deepest amount of pressure, you're going to be using those forearms there. So this technique that we're going in deeper with here, we're going knuckles, again, hands, we're going elbows, whichever you like, whichever you prefer, whichever your partner prefers. And we're going in on the muscle group we call the paraspinals. These line the side of the spine, just like that. We're going to try to avoid the spine. It's not going to feel great if we're going on top, especially with the elbows. Hands we can be a bit more lenient with because you're not going to cause any damage by going gently over top of the spine with your hands. Something that I like to do is teach you about using your forearm. So when I say forearm, I mean forearm. I do not go in with this elbow here, at least not at first. So if I'm massaging somebody, I'm starting nice and flat like this. Pressure is going into this area right here. If they like more pressure, I'll change the angle. They want more pressure than that, change the angle and go in deeper like that. But you don't ever start directly with that elbow because it is going to hurt. And we don't want to hurt them. We want them to like us. Ringing is a great transitioning technique that I use throughout the entire body. Arms, legs, back, does not matter. You have one hand on one side of the body, one hand on the other. So if this is the leg, one hand on the inside, one hand on the outside. And we're just swapping. And we're swapping. And we're swapping, and my hand is molding to their body. And so if I'm using it on the back, I'm pulling and I'm pulling. And this is not a deep technique. You're just using your hands, not much pressure in there. So this is a very nice, relaxing technique. And I use it in transitions if I'd like to switch to the other side of the body or do a different technique, or if I don't know what I'm going to do next. Sometimes I'll just ring it. Following that, you can do what I like to call either double thumb kneading or windshield wipers, and you're going to see why in a second. So how it goes is you keep your palms in place. I got a little cat scratch there. And you are just moving your thumbs. So You're molding your hands to their body. Every time you're doing a technique, your hand is trying to stay as molded to their body as possible. You don't want to be flexed because that's not going to feel good for you in the long run. You're going to end up injuring yourself. And double thumb kneading, or the windshield wiper, if you want to call it that, is the one that's going to break the rule of threes. So instead of doing it 3 times, because that's useless if you're just going to do it 3 times, you can do it for at least 2 to 3 minutes. And you can do it in one specific area. You can move around up and down the spine as you do it. One thing I will clarify, if you are choosing to do it up or down the spine, it's one or the other. With techniques, typically you want to stay moving in one direction just to help keep the nervous system relaxed. If you start going up the spine, down the spine, you can't really relax properly and you're activating fight or flight. I like to follow up double thumb kneading with some upper trap work. So upper traps are just these muscles right up here. Typically they're bigger on other people. I don't work my notes, so they're a little small. But they are the triangular muscles attached to the back of your neck there. And so working the upper traps, there's a few different ways I like to do them. You can do some compressions where you either hold with your hands, you compress with your forearm. And another one I like to do is kitty cat kneading or upper trap kneading, where you are alternating which hand is grasping the upper trap there. And so with that, I really like to reiterate that you're supposed to be molding your hand to their muscles. So you're not pinching them like this and just pinching and pinching and pinching and pinching. You are really grasping as much tissue as you can and then pulling back with your fingertips. So you're in almost like a crab grab like this, and you're pulling back, pulling back. And you can do it alternating like a kitty cat, I said, or you can compress, grab, pull together. Talk with your partner, figure out which one you guys prefer. I personally prefer the kneading. I will say you aren't able to get super deep with this technique just because of the position of the hands. If they were face up, I'd flip my hands over some kind of like this, and I'm able to get much more pressure like this, using their body weight kind of falling into my fingertips here. Ooh, that was a lot of double jointedness. A great technique that I like to use when my clients are experiencing back pain is what I call sacral decompression. This is the one time we're going to move from opposite ends. So we're going to go down from upper traps all the way down to those hips. And so I like to use my knuckles. You can use your hands, whatever's most comfortable. And I will anchor up at the upper traps, glide down the paraspinals. Once I get to the paraspinals, at the very end, we've got our sacrum. And so it's just a little triangular bone in our very, very low back. It's attached to our spine. It's typically where their pant line would end. You're going to anchor your hands in there as well. You're going to push down towards the floor and down towards their feet. So your pressure is coming in at an angle there. And you can hold this for either 10 seconds, 20 seconds, 30 seconds, a minute, whatever your partner likes. The other way you do it is with your hands, where you glide like this and you anchor your hands at the sacrum like this. You're kind of going to be grasping their hips here. I find this one is a bit trickier to get a lot of traction with. I kind of glide around a lot. I don't find that I'm able to get as much pressure as with my knuckles here, so I prefer knuckles, but try each out, see which one you prefer. Hopefully this video made sense. I hope it gives you a lot of visual cues as well as auditory cues to remember to slow down if I haven't said it enough. And then also just kind of like jogs your memory of some techniques that either we've done in the clinic together in the workshop, or maybe you've had done on you yourself. There hopefully will be some more videos coming in the future about how to massage your partner at home and more intricate techniques that you can use in those situations. See you.